At home.
You didn't age a bit. You look younger.
Uh, well, thank you. Maybe it's the way the light's hitting it, but my family says I picked up a few extra gray hairs while I was gone. And that's probably true. There were a few nights that called for that.
We certainly appreciate everything you're doing for us.
Absolutely.
Well, thank you.
We'll get going formally here. I think we're streaming now on Facebook, but we'll go ahead and get going formally in about 3 minutes.
We need some exciting countdown music.
Hey, John.
Good afternoon. How are you, Chuck?
Good.
Yeah, glad to be back with you.
Good to see you.
Yeah, thanks. Thanks, everybody. Brian, your team did a heck of a job. Thank you. Taking good care of Dawn. That was really quite a stretch, 10 nights there. So they did a great job.
Thank you. This is a wicked virus.
Yeah, it was nasty. They gave her a nice parade out and belt and all that stuff, which was so sweet. But that's what we need to do for them every day.
Right. When someone recovers, it's quite a celebration.
No, that's really beautiful. But I hope we can give them a big parade sometime in town. Your workers.
The community is recognizing them. They feel the support.
Good.
Okay, I'm waiting out a slight computer issue here, and then we'll get going.
Hi, Julie. Hi, Penny. I see you guys.
Good to see you, John.
There's Kirk, too. Welcome back, Kirk. You've had a long trip.
It was a long trip. Hey, it was good to see you at Bryant Park as we were social distancing and waving as I ran by.
That was a couple of weeks ago. Yeah.
Yes.
Yeah, nice. That was fun.
Thanks for the welcome back.
You bet. Glad to have you back.
Okay, and Ben Hunter will be joining us a little bit late, but I think we can go ahead and get going. So welcome everybody again to our regular Friday 1:15 talk about what's going on in the latest during the COVID-19 crisis. I am, as always, Chuck Carney, Director of Media Relations for Indiana University, and joining us again on this virtual news conference will be Mayor John Hamilton, Monroe County Commissioner Julie Thomas, IU Health South Central Region President Brian Shockney, Monroe County Health Department Administrator Penny Caudill, Monroe County Emergency Management Director Allison Moore, and IU Associate Vice President for Public Safety and Institutional Assurance, Ben Hunter. And to start off with, we welcome back this week Mayor Hamilton.
Thanks very much, Chuck. It's good to be back with you all. Let me first say thanks to all the residents who continue to socially, physically distance, as I like to call it, helping our community manage spread of this COVID disease. As we all collectively sent out that message this week, appreciate everybody continuing to abide by those guidelines. They really do make a difference. And just on a quick personal note, it's nice to be back here. I wasn't here last week. My wife had been in the hospital. She spent 10 nights there, thanks to the IU Health folks who helped her through a tough disease, and she's back home, which I really appreciate. We do all the outpouring of support, and I know that many families are going through that. And just from the bottom of our heart, thanks to the healthcare providers who saved her life, frankly, and are saving lives every day. We really appreciate that. And that's why it's so important that we continue to do the physical distancing and other protocols that are so important to help protect our healthcare system and all those who end up in it. I'll just give a couple quick updates. The economic side of all this, we have started pushing grants and loans out the door from the city. About a couple dozen entities have been approved for a little over $500,000 of loan support, business, basically bridge loans to help them get to success and get to other financial support that's out there. We're really pleased with the work that a whole team have done on that. We've actually gotten about 170 applications that have begun, about 50 that are completed. And again, about half of those have been approved so far. That work continues. If anybody does want to get more information about that, there was a 10 o'clock Zoom meeting today that took place to help small businesses and nonprofits and others kind of navigate this complicated world in front of them. And on the city's Facebook page, you can review and go through that seminar if you want to, that meeting that took place. So we're pleased with that. The second and final main point I would make is just that the social service group continues to do all we can to help make sure the safety net works, not only for essential employees, as we have, I know as the health system has, so has the city set up hotel rooms that are available for essential workers who feel the need not to go home. We have that set up, but we're also now the fiscal agent for the isolation center, a 6-county isolation center set up at Travelodge that has started to be used to help isolate people who don't have another option for isolation when they're facing the disease or recovery. And also the child care services being set up for essential workers, as I understand it, are going to be available starting Monday, the 27th, this coming Monday, as needed for private sector and public sector workers who have childcare needs. So again, thanks. Nice to be back. Thanks for all that the community is doing, and we look forward to getting to the other side of this thing. We're not there yet, but we're doing the right thing. So thanks very much. I'll take questions at the end.
Okay, let's go to Julie Thomas next. Oh, gotta unmute, Julie.
Did, and I will do it again. There we go. Twice is the charm. Thank you. Sorry about that. We just want to thank everyone and best wishes for Don Johnson for continued recovery. It's good news. And others in our community who are dealing with this, we wish them all the best. But clearly social distancing is working, and it's something that we sent a note out about this week. We continue in county government to work with our community to provide services. And so if anybody needs anything from a county government office, to please go to our website, co.monroe.in.us, and log in and find out what the contact information is. It could be an email, phone call. We're here to serve our community as best we can without actually meeting them face to face. Just a note from our county clerk, Nicole Brown, that absentee ballots you have to apply to get one for the June 2nd primary. And those ballots will have to come back by May 21st. They've decided to send out applications to everyone, but if you want to go ahead and send one, you can. But this is being done to try to protect the safety of everyone in our community for the primary election season. So please consider mailing in your ballot this year. It would help all of us in our community greatly. And we appreciate the election board and Ms. Brown's work on this. We did allocate some additional support for a couple of local food banks on Wednesday. And we also appropriated some grant funding for some of the local businesses in Monroe County outside the city of Bloomington. Those grants total a little over $68,000, and we have others in the pipeline to consider for our next Wednesday meeting. We're going to ask folks, because we don't know how long the governor's order will last, but this money is only available while the governor's order lasts. So we're asking any small business related to tourism operating in Monroe County outside the city of Bloomington to please go to co.monroe.in.us and fill out the application. It's an online web form, very easy to do, but we ask that you do so today because we have to have the time to interview and consider these, and our next meeting is Wednesday, and that's the last meeting we have before the governor's order is proposed to expire. And we don't know what will happen after that, but just to be sure, we do ask for folks to send those in today if they haven't done so yet. With that, we really appreciate all of our wonderful folks at Monroe County government who keep providing services for our community. A special thanks to Penny Caudill and Allison Moore for their hard work, and their staffs are great. So with that, I'll take questions as well. Thank you.
All right, over to Brian Shockney.
Got some sirens going on here in the background. Just give me a second. Okay. I'm going to cover three things today. The first one being the presumptive positive cases that we may see here as the State Department of Health starts to count presumptive positive cases in our community. And what this means is that a physician who listed COVID-19 as an underlying cause of death for a patient, but there's no documentation of that positive test. So this may show our numbers differently when the state finally starts posting those, and we just want everyone to understand that those numbers may change, and we'll provide some additional information as we go forward. But there's been some questions coming to me and others about this. We want to make sure everyone understands that these are not new deaths. We're just capturing those in a different way. The state is going back to capture those in a different way. And then there's two studies that are going on that some of our community members, maybe some on this Facebook Live, may get. And one is IU Health is doing a study for antibody testing, and it's called serology testing. And so we're reaching out to patients who have a cohort of patients who have recovered from COVID and testing them. And that's one cohort, and we're running this through our IRB, our review board at IU Health, and then 500 random samples that we will be then working with the Fairbanks School of Public Health to then validate some testing so that we can begin to do more of this antibody testing and serology testing in our communities where IU Health has hospitals. And the second one is a testing that's going to occur this Saturday. The State Department of Health reached out to IU Health across its regions because we cover a lot of the regions in the state, and they will be bringing their teams on board. They will be setting up at one of our office locations out on the west side in the parking lot on Saturday from 9 a.m. to 9 p.m. And it's by invitation only, but they will be testing, just do the COVID testing for trying to get 1,000 people through there in that period of time. They'll be doing this across the state, and their goal is to get at least 8,000 tests in the next several days and couple weeks here, so that they can get some prevalence rates of this virus in our communities across the state, specifically our larger regions. Bloomington, one of those included. So I just wanted everyone to know that that is occurring. The Department of Health, individual citizens will get emails. They may get postcards. They may get phone calls about going out there and going to that testing site. So we would encourage everyone. You don't have to have had COVID and recovered. It's just everyone and anyone. If you get contacted, we would really strongly encourage you to go there so that we can truly get some prevalence rates in our community as well as across our state. This will help significantly with the governor and our county government and others looking at and city government where we are in this pandemic and where we would continue to go. The next thing is the open for business. We've announced that we will be on May 4th starting surgeries. We will be reopening our surgery department at about 25% of its capacity on May the 4th. We still have our emergency department open and other areas, but we've got a backlog of patients, as you can imagine, who have not been able to get their surgeries. And, we've got people living in pain with hip pain and knee pain and other things that we really need to get to. But we have to be very careful because we still have, 27 patients in our hospitals with COVID. And that's not a whole lot lower than some of the, numbers we've had ongoing. And so we're still caring for those. Our resources are shifted toward those key individuals and patients we're caring for. So we have to be very careful. Also, we have to continue to make sure we're practicing social distancing. So I was talking to another administrator of a hospital in this region, non-IU Health, and they were having some concern around we can start surgeries again, but where are we going to put, they have to have someone take them home, and where are they going to put them and mask them and all those things that you have to do and consider as we start back up. So we're asking the community to be patient with us as we continue to be very methodical about this and be sure that we're protecting our patients, protecting our healthcare workers, and protecting our community as we ramp this back up. It's good news. Primarily for those patients who've had to postpone their treatment. And we've always been doing emergent conditions, and those have been, few, thank goodness. But we know there are a lot of non-urgent or elective. That doesn't mean they're not serious. It means that they could be put off until such a time we could start ramping back up. And also, please know that this is going to be a long process. So we're going to have COVID patients with us across the state of Indiana for quite some time. And as we've seen in a couple other counties where they're starting to see a surge where we're maybe seeing that flattening of the curve. And so we have to be cognizant of that and ensuring as we put the communication out this week that we don't see a surge and we continue to do all of our practices that are important. And then the last thing, we are hard at work to develop IU Health's plan for restarting non-urgent clinic visits and those kind of things as well. That's going to be later down the road, but we want to be sure that we're planning for, that we're planning for that. And we're continuing to look at ramping up those outpatient clinics and other ways, other services in new ways. We've found that many of our patients really appreciate the video visit, the virtual visit. They like not having to leave their home or workplace. And so we're going to honor that. We've been able to, when in crisis, sometimes some great things come forward. And so we're going to be doing, we went from maybe 10 or 12 video visits a week to over 1,200 video visits a week in just a very short period of time. And so we're going to continue that and make sure that our patients have the access that they want, how they want it in the future. And so it's been a really good thing for us as a healthcare organization, as a healthcare system. And I also will take questions at the end.
All right, so then we'll go over to Monroe County Health Department and Penny Caudill.
Good afternoon. Thanks for having me. And Brian, you kind of stole some of the thunder. You got to go before me and share some of those things. Thank you. And I'll maybe add one or two things to that. So our health department, I want to just kind of start off with some of the things that we have continuing. We're still doing our birth and death certificates, our septic complaints and installs. We're issuing various permits, but these are all managed right now through the mail or through online services. Staff are available and they respond to calls and emails, although it may take longer than usual because of our also responses to COVID-19. A few things that I did want to highlight this week that we've really kind of been working on, and I may have mentioned before, but kind of have come to fruition this week. And Chuck, I don't know if you have that one picture that I showed you.
Yes. Which one do you want now?
Either one, the kit or did I send the one with passing out?
I think you sent them both here. We'll see how this technology works.
Either order works. But one of the things that we've done is kind of start a peer outreach education program. And it's really in regard to getting information out to people who may be experiencing homelessness and not have this information or things. So we have put together a kit, and this is a picture of it. It includes a bandana and some hand sanitizer, and kind of a shout out to the Mad Optimist for putting those labels together and donating those to the kit. And then more importantly, to make those kits available, there's also information in there, a reminder on how to do social distancing and how to protect yourselves. But we've been able to get some volunteers to do the outreach for us. And Wheeler helped us identify some people who are very excited, and they have already started their work. They've reported back their experiences, and we are seeing great skills, problem-solving skills in these individuals, and they're really excited to be part of the team. Someone even kind of called them our frontline soldiers, and so they are out doing sidewalk outreach and public outreach to people so that they know how they can protect themselves, how they can protect others, that they have some hand sanitizer, and that, quite frankly, that they have something to use as a face covering to protect others. So we're excited about that program, and we'll be reporting back on how that's going as we go through this. But they're very excited right now, and they've already started that work. So thanks, Chuck. Those great. Thanks for showing those. The other thing that our harm reduction staff has been doing is making sure that people have naloxone that may need it, and that they really know how to use that in face of COVID-19. And there's not a lot of direct, clear information necessarily, except that if you come across somebody and you need to use naloxone, in this circumstance, it's probably best to simply use the naloxone, stand back, make sure you've called EMS, but not to do the rescue breathing unless you're with a family member or someone else, or unless you are EMS and you're using your safety protocols. So we're trying to get that information out as well. The COAD, which is the Communities Active in Disasters, is a lot of organizations and businesses in our community, and they have prepared a resource list, and they've got a flyer, but they've also put together some postcards, and those will be going out in the next week. And the target group that these are going to are people over 50 who have an income of less than $35,000. And it has 211 information on it, helping Bloomington, Monroe information, so that people can access resources and see if they need food or shelter or help with transportation or whatever it might be, that they have access to that. And then there's just some general information as well. So that's a great undertaking for them, and we're happy that that's occurring. Kind of to tag on to what Brian was talking about, the Indiana State Department of Health and IU Fairbanks School of Public Health announced yesterday, the governor announced the study and partnership that will include randomized testing. So the reason that you're getting that invite is because because this is a research study in part to look at prevalence in our community, we'll get a snapshot of the prevalence of COVID-19 in our state and our community. They've randomized who they're selecting so that we get a representation for our community. So echo Brian's sentiments. If you get that invitation, please take them up on that and be a part of that. It doesn't matter if you've been diagnosed and recovered or you haven't been diagnosed at all. So it will help guide a lot of things in our community, but certainly that information to reopen and how we phase that back in will be part of that. It is a year-long study, and so there'll be different phases of this as we go through. And also, to reiterate, the other thing that Brian talked about is the change in kind of those clinical deaths and clinical diagnoses. So the dashboard will look different going forward. We don't quite know exactly how that will be represented on the dashboard at this point. Some of that information will come off death certificates, but where physicians may have thought it might be COVID-19, but they didn't have the ability maybe at the time to do testing, that sort of thing. So another way for us to get big, complete information or more complete information about what's been happening and then what will continue to happen. The state and local communities, and we've heard this already, are working to develop a strategic phasing of how we can get into that new normal. I don't think Allison Moore was able to be on the call today, but she let me know that the main thing that they're focusing on right now is kind of that re-entry and what that new normal looks like, and also EMS kind of preparing for possible surges or second waves. So we hope that those things don't happen, but we have to be prepared for them. So just to keep in mind that as we think about next steps and we think about what happens when we reopen, that it will have to be incremental. It will have to be phased in. Brian, you used good examples of just how the hospital is doing that. And we'll want all of our businesses and agencies and individuals, quite honestly, to be thinking about how we do that in small stages and kind of take baby steps so that we can watch what's happening and watch what the response is as we go through that. I think that those are my main things I wanted to share today.
Okay, thank you. And so Allison is not here, so we'll go to Ben Hunter. Ben, if you're there.
I am. Thanks, Chuck. Just to follow up on, I know the study's been talked about, just to follow up, it is a year-long study, and it'll be taking place throughout all of Indiana. We're excited to partner, as always, with the state and IU Health on that, and Eli Lilly. So you'll be hearing a lot more and a lot more updates about that to come. For Indiana University, our general planning continues to move forward. We have several committees, as I discussed last week, that are in place, that are following the lead of our restart committee that President McRobbie put in place. We'll continue to look and monitor how other institutions are doing their planning for any type of presence in the fall. We don't know how that will pan out. We've been looking towards our partners at the Big Ten and other Indiana institutions of higher education as well. We will continue to look at CDC and state guidance in all those areas. As we've talked about, some of you have talked about the phase in, so we'll monitor those type of guidance issues, and then we'll work at Indiana University to see what's best for the institution, our faculty, staff, students, and visitors. We don't really have answers around a lot of that. I know I've gotten questions, I'm sure Chuck has gotten questions on, will there be football? Will there be basketball? We those are things that are still out there. We just simply don't know. We'll continue to work with, like I said, the Big Ten on that. And for IU, we have Division II sports as well and our regional campuses. So we'll continue to work throughout the state to monitor any guidance that we get from that standpoint. If the most up-to-date guidance for IU is at our coronavirus.iu.edu webpage. That will have a new look starting next week, be more user-friendly. Would encourage you to continue to visit that. We will continue to put updates out there for all aspects of Indiana University throughout the whole system. So the best way to stay up to date as to what we're doing and additional guidance that we're putting out there for IU. As our planning efforts ramp up, I just want to thank our local and state partners, the city of Bloomington, the city of Indianapolis, all the cities that were located throughout the state have been great. I think the big question for IU and our staff is that we want to continue to work with local health authorities, the state, and the CDC. We're anxious to see what the state guidance is in the next few weeks. We'll continue to monitor that, and we'll see what the impact has to Indiana University as a whole.
Okay, thank you, Ben. So we'll get into questions that we've had come in, and the first one is for Mayor Hamilton from Dave Askins from the B Square Beacon. The City Council is having its 2021 budget advance meeting next week. Ballpark numbers: $4.8 million in the rainy day fund, with a general fund budget of $47 million. Sun shining today, but fiscally speaking, rain is definitely in the forecast. Question: how much of the rainy day fund are you willing to tap to keep things as normal as possible for as long as possible? And the second part to this question: what kind of mindset should council members adopt to make their budget advance meeting as useful as possible for the administration's budget planning?
Well, let's use the word cautious to start with. It is a little striking that our normal process for the 2020 budget does begin, for the 2021 budget does begin in just a couple weeks with that, what is a traditional time when city council members express their interests and concerns and such at what we call a budget advance. But more generally, let me just talk about we're in a very good fiscal position in the city. I believe the county is as well, with strong reserves. We have over a third of our operating accounts in reserves. That's been a standard that we set a few years ago. And so I'm pleased that we're in good fiscal shape, but it's a very uncertain environment, to be sure. We certainly encourage the federal government to take significant steps to support state and local governments. That's a very, very important thing to be done that isn't done yet. But we're going to be going into a budget process very cautiously. We need to be sensitive to a lot of uncertainties, and that's going to be kind of a watchword, I think, as we go forward. That being said, governments are anti-recessionary or counter-cyclical organizations. We need to be present and stepping up when the economy is in trouble, when people are in trouble. And we certainly look forward to continuing our services as we do now, county and city, to help provide the kind of backstops that are so important. So it's going to be a lot of uncertainty, but we're beginning that process, and it typically will lead to an August significant budget review, and then later in the fall adoption of the budget for 2021.
Also for Mayor Hamilton from Emily Ernsberger from the Herald Times, and I feel badly I didn't ask this off the top. How are you feeling? And then more specifically, do you still have flu-like symptoms?
Well, thank you for asking. You don't need to ask me. I don't feel 100%. But I don't feel terrible either. I do have some fatigue, occasional temperatures. This is maybe more than people really want to know. I have actually now had 2 tests for COVID just to be sure, and both of them have been negative, even though my household has obviously had COVID. But I'm getting there. I'm on the way back. Thanks a lot.
All right, for Brian Shockney, a few outlets have reported that a Monroe County patient died of COVID-19 that he contracted while being treated at IU Health for an injury. When you open up May 4th to elective surgeries, what precautions are you taking to make sure non-COVID patients remain safe, aside from not opening at complete capacity? Oh, not quite unmuted, Brian.
I think Mayor Hamilton used the right word, uncertainty, with this virus. Trying, and Penny can probably provide more around this contact tracing, how people are getting the virus. As Mayor Hamilton said, he has 2 people in his household with it, and he's tested negative twice. So we really don't always know how people get this virus. So I'll just start with that. Second of all, how we ramp back up. It is complicated, and that's why we're only going to ramp up at 25% when we start, and we will stay there until we know and feel comfortable that the data is demonstrating that we're able to do that well. How we protect patients, we do this with our universal precautions or standard precautions. And we have, since this virus started hitting our community, we started setting up our specific COVID units. And so specific people are in those units. All of that air there is negative pressure, all of the PPE. We've always had good supply of PPE and have a terrific supply going forward. So we've looked at that. We can't open without a good supply of that going forward. And we have predictive models that not only Indiana University, but Purdue University and the Indiana State Department of Health have worked with us to create these predictive models for all of our supplies as we ramp back up as well. And so every patient that will come for a surgery will be tested within a 96-hour window before they come in for their surgery. So they will get a test, and then we treat every patient who walks in the building as though they could be shedding the virus. They may look very fine. They may be coming to our emergency department for, a broken finger, but we mask them when they walk in the door, and all of our team members are all donned up with PPE, and they've got the proper PPE masks and the like. So we're well prepared to be sure that there's no spread of this virus while people are caring for us. But I will go back to the very beginning of my comments around uncertainty as in contact tracing. And I know Penny could share even more on that we've learned over the past few months about this virus, and continue to learn, and will continue to learn, hence why the Fairbanks and the State Department of Health studies that we're doing.
You answered a little bit of this, but I'll go ahead and ask it if there's anything that wasn't addressed from Ethan Burks from WTIU, WFIU News for Brian. What types of logistical challenges do you foresee happening with reopening surgeries on May 4th?
I think the best way to talk about that is all the pieces. So I'll give you an example. So I gave you the previous example about where you're going to put patients, visitors. They have to have someone to drive them home, even if they're outpatient anesthesia or light anesthesia. So there's the logistics of moving people, but it's all the suppliers too. So how do we assure that if I'm scheduling you for your hip replacement 4 weeks from now or 2 weeks from now, that the supplier and their supply chain is up and running, and we have that specific fit, that specific prosthesis that you need in equipment. So that we're always going to have to be working 2 to 3 weeks ahead of that. The other logistics is we have, a COVID patient takes 2 to 3 times the resources, manpower resources to care for. And resources dollar-wise as well, with all the PPE and the drugs and IVs and all those things. And so we have to be sure that we've reallocated those resources, for example, those surgery personnel, to ICU and to these COVID units. Now we're asking them to go back to their main areas to care for patients. Well, we've got to backfill those positions that they're going to leave on those COVID units, because those patients are still with us and will remain with us. So as you can imagine, it's taking our time, just as we have our incident command, part of this healthcare incident command system that we have nationally, we're using that incident command to ramp back up operations as well. And so every day we meet twice a day, sometimes more than that, to put the pieces back together and look at all those logistics to be sure they're there. Simple things like, if we haven't used an operating room in a few weeks, going through there and terminally cleaning that operating room, checking every supply on a supply cart in a supply room that may not have been used and turned as frequently, to be sure nothing is outdated on that supply cart. So as you can imagine, there's a lot of work and a lot of detail that we all have to be focused on to be sure that we keep our patients safe.
Okay, again from Ethan for Penny Caudill, how many of those safety education kits do you plan on giving out, and what do you hope the impact is?
Great, Ethan. We plan on giving out at least 100 of those. I think we've got over 100 that are prepared and ready to go. And those are given to the peer educators in small batches. So they may get 5 to 10 at a time to take out, so that we can kind of keep track of how they're going, to some extent, not necessarily who exactly they're going to, but what areas they're going to. And we talk with them on a regular basis so we can get that feedback. So we hope to give out 100 or more, and we'll see how that goes. Maybe we will do even more. Maybe we'll have to put together more kits. The impact, we hope, will be that people who may not have access to a face covering will have one. A bandana may not be the perfect thing, but it is something. And if I don't have anything, then it does allow me to do my part to protect those others around me. Hand sanitizer, if I don't have access to hand washing, then hand sanitizer is that next best thing. So we're hoping to that impact to be able to give people things that they need to keep themselves safe so that ultimately we can prevent the spread of the infection, that they're less likely to be infected. This is, people who may be on the street or housing is vulnerable for them. Maybe they don't have any housing at all. Maybe they stay in a shelter, maybe on the street. We want to be able to protect them as much as possible and give them the information. I may be able to read the paper or go online and see the paper or read the news, but not everybody has that access. So that's the kind of impact that we're looking for. And on a side note to that, just already in talking with these individuals and the staff reporting back, they've already identified some great skills in the peer educators that we have, problem solving, and just good one-on-one kind of, this person is a natural educator and that kind of thing. So we're hoping even when this is done that we'll be able to give them something that says, hey, they worked on this project with us and these are the skills that we saw in them. So if they're looking for a job, then maybe they have that as kind of a reference for skills that they have that we saw.
Okay, thanks, Penny. And sticking with you here, Joey Bowling from the IDS asks, you said that Wheeler Mission is the community partner for the sanitation education kits, correct?
Correct. They helped us identify the peer educators.
Okay.
Yes, they are one of the partners.
And then sticking with you from Jen Tilley from the HT, when the previous deaths with suspected COVID-19 are added, do you know yet if those are added only to the death count or also to the confirmed cases?
Yeah, Jenny, I don't know exactly yet. That is a change that is coming to us just this week. And so we're still waiting to see a little bit of that. The FSSA handles the dashboard. And so I don't know exactly what that will look like. I do anticipate that they will become, they probably won't become confirmed cases, but they will be identified as a potential case. I don't know exactly what that will look like, but I do think that there will be some reflection. Now, keep in mind, too, that testing is being done. Now, a coroner or the hospital, if someone passes and they were not tested, but they think that they may have COVID, they can do testing, and those would be confirmed cases. So short answer is I'm not exactly sure what it's going to look like, but we'll keep you apprised as that comes. But I guess just be aware because it could change on the dashboard in a moment's notice, and we won't have a lot of advance warning about that, but we'll certainly share it as it comes.
Okay, we got about 5 minutes left here for questions. We had a question from Abby on Facebook asking, and anybody can take this on, do we expect the stay-at-home order to be extended?
Well, I don't think any of us has a crystal ball, so I don't think we know what that exact answer is, other than that we have to look and see what's going. Right now, the information is that, especially here in Monroe County, we're doing a really good job of kind of keeping that curve low and flattening it. But we have to look at the whole state and not just our county. So I don't know what will happen. I would not be surprised to have it be extended for a little while. But I truly don't know and wouldn't want to make a real guess. I don't have the information the governor has. And we'll we'll have to see what comes, I think, next week. We've all talked about things changing from day to day, and honestly, they change from moment to moment sometimes. So I think that everybody making those decisions will have to see where we are next week, and as we get closer to that, and use the best information that we have at the time, because what we look at today, it's going to be different next week.
I might just add a couple points. I think Ms. Caudill made the right points. I would just say one, that it's really important to note that what we have done seems to have really helped. The community has helped protect the healthcare system. It's terrific news that the healthcare system can gradually look to reopen and help providing other important health services that they've had to hold off on. And that's because the community has done the right things and flattened that curve. So that's really important to note. The second point I'd make is, regardless what the governor does exactly, it's almost unheard of that we would turn a switch and say everything's open again. It almost certainly will be very incremental and very detailed and step by step, and it may be different in this county than another county. And I think the governor is working closely with other Midwest governors to look at how they're doing, and university is looking, as you heard, to other universities. So I think we'll almost certainly have very, very incremental and granular changes over the weeks ahead. So don't expect any dramatic pull the curtain and everything's going to return to what it was. It's going to be a long haul, and that's as it should be, as we're cautious in restarting and reopening a lot of things.
Absolutely, I agree totally with that.
Okay. Well, we are virtually out of time to emphasize the point that was just made about the progress that we've made. There was a statement that came out yesterday with all the partners here on this call, the Bloomington Provost signing off for Indiana University, noting that very fact and telling everybody to keep up the good work. So that is it for our virtual news conference today. We will again plan on meeting again next Friday at 1:15. Thank you for your questions and your time.
Thank you, Chuck, for your work.
Thanks a lot, Chuck.
Thank you, Chuck. I appreciate you. Thanks.